Welcome back to Healthwise. With us is Ginger Fontenot with the Cosmetic Health and Laser Center. They're right there where Louisiana Urgent Care is, across from Walmart. And tell us a little bit about it. Let's talk about the laser. I think it's Laser 360 that y'all do over there?
It sure is. Laser 360 is 3 different laser technologies that are combined in 60 days. And it gives your skin a complete rejuvenation. It takes care of pigment problems, broken blood vessels, loose, lax skin, and it also does resurfacing, which helps the tone and the texture of the skin.
Okay. I guess what first thing everybody's going to ask is, does it hurt?
No, it doesn't hurt. It actually doesn't hurt at all. The lasers are, they've been FDA approved for over 60 aesthetic and medical uses, and they're safe on all skin types and all different ethnic backgrounds.
Okay. Well, since y'all have moved over there, and I guess, well, how long have y'all been there? That's a good question.
We've been there for 2 years.
Wow, 2 years. Dr. Elliott?
Dr. Leon Elliott and Dr. Patrick Moore are the physicians that I'm associated with.
Dr. Moore, where's he from originally?
Dr. Moore is from up north. I want to say North Louisiana.
Oh, okay. All right. Have y'all had a lot of patients or clients since y'all moved there? I mean, how's business?
We do. It's really grown a lot. And the clients actually love the laser procedures. They feel like it gives them a complete rested appearance.
Okay. Also, I noticed at the beginning they put your name and they had the title of where you work and they had the phone number. Now, crew, I've seen Ginger. Normally she's in scrubs. She doesn't look all dressed up like this. So, want to tell y'all, don't call just to get a date. You know, call to go. So, but Ginger, like I said, I guess you said it's 3 different lasers. So when you do this, you go like, it's broken up like you do the first laser first, the first laser treatment first?
We usually break it up into 2-week treatments. You get 1 treatment every 2 weeks, and usually it's a combination of laser treatments. The lasers actually penetrate different levels in the skin. Mm-hmm. So we start with one that does the most superficial, and it takes care of the brown and the red spots. And then we do the skin tightening, which actually heats up the collagen and causes the collagen to reform. It's used everywhere on the face, the neck, the chest. And then the third part of the treatment comes in with the resurfacing. And that actually gives you a better texture and tone to the skin. Okay.
So, so you do the first part. Is there any, I would want to say, because I know with some types of cosmetic surgery or treatments, you end up having some downtime, you end up having some what they call recovery time. Is there any with that?
No, there's no downtime, which is great, and you don't have to take time off of work.
Okay, so you can go straight in, get the treatment,
and go
straight
out
back
to dinner.
Work. Oh, okay.
You could go.
No, I want to, you know, when people think laser, they think burn, you know? So I guess you could explain to the audience a little bit about it's not hot enough. It doesn't actually burn the skin as much as, right, and leave scarring tissue or anything like that.
Well, that's the thing that you have to be careful of with lasers is that you always want to be cautious so that you don't burn someone's face. Mm-hmm. That would be the worst thing that could ever happen to me. Because then you're trying to take care of their scar instead of make them feel better about themselves.
Okay. All right. Well, also, is there any medication they have to take? You know what I mean? Is there any kind of medication?
There's no medication. When we do the last part of the Laser 360, we do the resurfacing. And what we do is we put a number, a topical number on, and then they hang out, look at some magazines, and then we take that off, and then we do the pixel, which takes off not the complete outside surface of the skin, but it takes off some bad skin and leaves some good skin so that the healing time is really fast.
Okay, so that particular part of it, you know, like you said, so you're healed like after that, you might not be able to go out to dinner that last
Usually you want to take maybe a day off, and it's not that you're restricted in any way, but you kind of look like you've got a sunburn for about a day or so. But then we call it our magic eraser, because we can go in and we can resurface acne scars. We go in and we laser over the wrinkles and we just erase them, and then we come back and do the full neck and face treatment.
Is that, is that covered by insurance?
It's not covered by insurance. It's considered cosmetic, but it's a very, very good alternative for someone who's not ready for a facelift, who's tired of spending money on lotions and creams that aren't doing the job, because it actually gets your skin back in good condition.
Okay. And I guess one more question before we go to break. You were saying like it takes the place of a facelift, so are the results similar?
It doesn't take the place of a facelift. It's for someone who's not ready to go under surgery. You do get tightening, you get that nice even complexion back again, and then you get a nice smooth surface. So it just rejuvenates the skin to what you had probably about 20 years before.
And how long does it last generally before you have to get it redone again, the 360, the whole treatment?
Majority of the patients, you're going to continue to age. You still have the sun, the elements that are in your daily life. So with a good sunscreen, it's going to give you a good 5 years. Majority of the patients will come back and do about 1 treatment a year for a touch-up.
Okay. All right. Well, we'll take this break for a brief message from our sponsors, and we'll come back and talk to Ginger more about the laser treatment. I think she has not samples, but some examples of lasers and stuff, and we'll get a chance to look at them and see what they look like. And we'll talk back to Ginger after this break.